Well, welcome everyone. We are glad you are here, and we are really, really excited at Wisconsin Literacy, Wisconsin Health Literacy about this opportunity. This is really our first time that we've had the opportunity to really provide subawards that are allowing our community partners and literacy agencies to do significant work around in their communities, in this case around vaccination, community outreach. And so just to give you a little background on this project, we were awarded a grant sorry about that, it's going to be 2 dings, 2 minutes late. We were awarded a vaccination community outreach grant last spring, and we ran a 5-month pilot program April through August in 2021, focused with our literacy member agencies to reach out into the community and have important conversations as trusted messengers about the vaccination. And we had a great group of literacy agencies participate in that pilot program. And DHS came back to us late this summer and early this fall and asked us to consider a statewide project using federal HSH Health and Human Services funding to work with communities statewide to have a broader reach, particularly in targeted communities with low vaccination rates and other communities that have very low vaccination rates. And so we are really excited to do this. And as I said, this is kind of our first time offering an RFA through this funding to both literacy agencies and community partners. Our health literacy division with this funding was allowed to kind of build its infrastructure to support this work and to support all those subawardees that we hope will be applying and working in their communities around vaccination outreach. So Stan is going to talk a little bit more about that, but I wanted to let you know that that Wisconsin Health Literacy will be providing plenty of support around these subawards with the personnel that we've been able to bring on board for this project. And I'm just going to ask real briefly in applying for these, it's really our hope that you'll take kind of a deeper look into your agency's capacity around 3 things. And that's one is to partner with others in your community that might be partners that can help with health information or that you know are serving a specific population that might be connected to your clients as well or your population, but that you can partner with for a broader reach. The second thing is to consider would be your agency's position in the community and with your students or clients as a trusted partner, and thinking about how important that is, how you may already be serving your students and clients as that trusted partner for information, and particularly for health information and other life services and that people need and often ask sometimes at literacy agencies and community agencies. And then the third thing is just considering how you may already be engaged in building digital literacy skills or health literacy skills or science literacy skills with the community you serve. And so sometimes we are already doing this and don't know it. And what this grant really wants to do is to support you financially to be able to do that around vaccination. But while doing that with vaccination, consider how you are building digital literacy skills, health literacy skills, and science literacy skills among the students or clients that you're serving. And I think that's really at the heart of this, this grant as it relates to vaccination. And also know, again, as I mentioned, that Wisconsin Health Literacy, the grant allowed us to build support around our infrastructure to support subawardees and help you kind of walk through this. It's a 3-year grant that runs through December of 2024. So again, I'd like you to think about building something that you might not already have with the support that these subawards can offer your agency. And a chance to just build your capacity around things that you might already be doing, but that you can do, with much more support and guidance and funding. So with that, I will turn it over to Stan Hudson, our Health Literacy Director.
Hello, welcome everyone. Thank you for attending today. I'm going to give just a broad overview talking about the project and our goals and the support. And then I'm going to turn it over to Margaret Marcoux, who is our program manager for this project. And so she'll get more into the details. And then after that, we'll have Debbie Kuchin, who is our fiscal manager, really talk more about the application, especially the budgeting piece of the application. And as you go, please feel free, as you think of questions, to write them into the chat. If we don't stop and directly answer them, we can definitely get to them at the end. So we'll be able to answer all of your questions. And so kind of the purpose, I think Michelle already really covered this very well, to really address those barriers and really promote more acceptance of the vaccination for COVID-19. And the idea is, we're not trying to go out and do this outreach and education and debate folks and convince them that this is the only way. It's really to go out into communities, really understand what those very local and hyper local even concerns are in those communities, being able to provide accurate information to folks so that they can really make the best decisions for themselves. And that's really our approach to this. And especially reaching into those counties and those communities that have those lowest vaccination rates. And I know we've got some rural counties that have pretty low rates, but then even when you get into some of the urban counties and counties that look pretty good, when you get down to like the census tract level, they can be pretty low rates in some of those communities. And so really trying to do a better job of addressing, as Michelle said, health literacy, science literacy, and digital literacy as we do this work. And so, our goals are really to provide that accurate, easy to understand information that addresses those three things. So health literacy is really, doing a good job of using plain language and explaining things in ways that people can understand. I think one of the challenges of COVID has been that we haven't done as good a job as we could have on science literacy. We made a bunch of assumptions about what people think about science and that process and what that means. And we really need to do a better job of explaining that, that science isn't necessarily just a body of knowledge that's set in place. It's more of a process of discovering knowledge, and that things do change, especially in the case of COVID, which was something brand new to science. We had to do a lot of studying, and of course, things changed as we learned more and more.
You've got cookies in there?
And then digital literacy too is going to be one that we'll definitely need to address. That's something that we kind of encountered as we were doing that first more pilot stage of this work, is that, we would get people who were interested in getting vaccinated, but then having the skills to, have an account somewhere or be able to log in to the internet and be able to search for reliable information or a place to be able to go get the vaccine. And then to even sign up for that vaccine. I know when I had to sign up for my first vaccine, I had to use a QR code. And we often make assumptions about what digital literacy skills folks have and how that plays into their abilities to be able to make these decisions and then really be able to act on the information when they decide to do so. The other program goal is really, like I mentioned, just to increase the knowledge and awareness about COVID-19 and the vaccine. So really, doing a great job of providing accurate information that's easy to understand on how COVID-19 spreads and the dangers and the risks, if you do get COVID and those long-term effects that could be associated with it pending. And then two, to talk about, those compared to the safety and effectiveness of the COVID-19 vaccines and really understanding that trade-off between getting a vaccine or what you might experience if you do not get a vaccine and get COVID. As well as, just the general benefits of being immunized. I think that's something that we need to do a much stronger job on now. You know, prior to COVID, there was definitely what you'd call vaccine hesitancy, but it was much smaller. And now we're seeing people, you know, not wanting to get flu shots, not wanting to get their kids their normal vaccine regimens and things. And so we've really got to do a better job of really making sure that people understand those benefits of being immunized from other diseases as well. And then where to access COVID-19 vaccines, specifically for those who are uninsured or underinsured, and especially for refugee and immigrant populations who may fear different access points because of worries about their status and things like that. And then really supporting folks in navigating those systems. Unfortunately, this grant can't provide clear transportation support, but there are links to the community and even some ways within this grant to really, you know, help people not only navigate those digital systems that they need to be able to sign up and get their vaccine, but then also being able to physically get to that space and being able to do that. And as part of this, as Michelle said, we're going to provide a lot of support. You know, our approach really is we understand that the individuals who are out, you all are the ones who are most trusted in your communities. And so us trying to go in and provide this information is not the best approach. And so we really want to support you all in reaching out to your communities and sharing that information. And so, of course, that will be funding support through our, you know, through these subawards to really enhance that awareness, accessibility for vaccines. We'll provide technical support for subawardees on completing the RFA. We have 4 regional specialists that will be helping folks depending on who's in your region and completing and making sure we get all the information we need to consider for the application. And then if you're selected to be awarded, then we'll also provide technical assistance in helping you with financial reporting to make sure that we're getting everything that's required by the federal government to report, as well as the evaluation and some of the outcomes that we're reporting. Like I mentioned, our goal is not necessarily we can't fund a direct vaccine, so we're not trying to count how many people get vaccinated. We're just really trying to count how much outreach and education we do to folks. So then we're planting those seeds for when they're ready to get vaccinated, they can do so. And then it will also include training for outreach staff and community members. So this is not just open to the subawardees. This is open to anyone doing COVID-19 community outreach and education. And these will center around some of those things we've talked about. We'll do specific sessions on, you know, just communicating about COVID, sessions on how to really integrate health literacy in your outreach and education efforts, how to address digital literacy, and as well as addressing science literacy. And so we'll provide those trainings throughout the year, as well as recordings to those trainings. So any staff or anyone doing this work can watch those trainings and hopefully learn a few new techniques as they get out in communities. And then another thing that we're going to provide is really tailored materials. That was one of the things that we learned in our pilot kind of phase, was that the communities vary, and even within a single community, you may need different materials to really address those concerns, as well as different ways and mediums to deliver those materials. And so we've got a great team that's really used to creating very easy to understand information. And so as you work with us, if you let us know, you know, which community you're working with, what the concern is, what you think is going to be the most effective type of medium and messaging, we can help design that and provide those resources to you. And then last but not least, as we're doing this work, we're going to be communicating with other partners who are working on vaccine community outreach and education in many different ways across the state. And so we can always connect you to others in your region so that we're not duplicating efforts and can really leverage all the activities that we have going on. And so now I'm going to turn it over to Margaret, and she'll go into eligibility and more of the details of the request for application.
We just wanted to go over the eligibility so you know who would be eligible before you take a look at the application. Applicants must be based in Wisconsin, as well as perform their proposed project in Wisconsin, and be either a local tribal government entity, nonprofit entities, projects sponsored by nonprofit entities or school districts. Next slide, please. So we wanted to let you know in advance that the request for application document and the budget template will be due by April 1st. Our committee will review them and notify people of awards around April 22nd. We're hoping the project can start around May 1st. And the first cycle, because we're a little bit into the year, will be 14 months. So that'll be from May 1st of this year until June 30th of next year. So the applicants will be awarded based on available funding capacity and the scores that are given by the review panel. In your application, please address how your project will increase knowledge and awareness of factors such as COVID, some of the things that Stan went over before, how it spreads and the dangers it poses, the long-term effects that people can have. There's a lot of articles now about long COVID. So there's obviously after effects from people who've been infected with COVID and the fact that they can be reinfected. We also want to address the safety and efficacy of the COVID-19 vaccines and where to access COVID-19 vaccines in the community. Some communities, people can get it right from their doctor. Other communities, there's special places to go to get it. And support in navigating systems or overcoming barriers. Some people might have English as a second language and not be sure how to access these things. People who have low digital literacy levels, might be used to using email or just doing internet searches, but they might not understand how to navigate the system to, move through several pages of making an appointment. So these are all things that will be helpful to address in your project. Next slide, please. Applications will be considered favorably if they're culturally competent, serve one of the populations listed, any marginalized population. Of course, comply with public health guidance about COVID-19 from, like the CDC or the state health department, are capable of producing immediate impacts on knowledge and awareness of COVID-19 vaccines and ability to reach a large number of marginalized populations or those areas of lowest vaccination. Also, understanding the target population, if you regularly work with English as a second language, elderly people, people with disabilities, populations with people of color, there's all kinds of populations that we're trying to address here to increase the equity of the vaccine. So addressing any of those populations will be beneficial, and especially if you have already an established relationship with those populations. Also, entities led or staffed by people of color, with people with disabilities, or the LGBTQ community. So just to go over the expenses a little bit, our grant this time is slightly different than the grant we had last summer. The allowable expenses for this one will be personnel such as salary, wages, and benefits. Travel, so like mileage, but it does not including meals or any food. Supplies such as office resources, contractual costs for staffing, and indirect expenses for like operational needs, and translation and production or printing services for different languages or messaging directed at your community that you serve. Things that are not allowed are capital purchases or leases, reimbursement of costs that happened before you became an awardee, funding of advocacy or lobbying efforts, purchase of vaccines or clinical care is not allowed. Also, incentives are not allowed. I think on the previous grant, they were allowed to buy fuel cards or something like that. But And this one, this money is not to be used for incentives. Reimbursement will not be provided, to the purchase of food or meals, like I said before, and stipends and honorariums are not allowed under this grant. Neither are bandages, gloves, or disinfecting wipes. So now we will move on to the question portion. So please actually, I think that we will go to Debbie first to talk about the budget, and then we'll take questions after that part.
Okay. Can everyone see my screen?
Can you make it a little larger or no?
Yep, I will.
That did something odd to your screen.
Yeah, just made it a strip, Debbie.
Okay. I'm going to unshare.
You want to reshare?
Yep. All right, let's try this again. All right.
There we go.
Much better.
Okay. All right. I'm not going to go over the direction page of this template. I think everyone can read the directions, but what I am going to do, these directions literally go line by line with the template itself. So the second tab of this document is the budget template. And we are trying very hard to make this as easy as possible for anyone who is applying for a grant. So you will enter your agency name at the top, and you will enter the date of participation, which will be from May 1st of 2022 until June 30th of 2023. That is the time period for this specific round of funding. Then what we're asking you to do, we know that the bulk of the work that's going to be performed is going to relate to personnel activities. You're going to either have someone on your staff currently, or you're going to be hiring someone to do this work. So in this example that I'm going to use, we have a staff member, his name is John, and John is going to add 10 hours a week to the current time that he's working to work on this grant. And over that time period from May of 2020 to June of 23, it's about 60 work. It's about 60 weeks. So that's 600 hours of time over that period that we're expecting that John is going to work. And we're going to pay John $20 an hour. So we're going to put the hours in and we're going to put the rate in, and it's going to calculate, the budget itself is going to calculate the value of John's time. Maria is actually going to supervise John, and she's going to work about 2 hours a week supervising, and she may actually do a little bit of work generation herself. And that's 120 hours. And Maria is going to be paid $25 an hour. Now, if you are not sure, if you're going to be hiring a new person and you don't know who they are, it's fine to just leave this as employee 1 and not put a name with it, okay? But it may be easier for you if you know your own staff to be able to put their names in here. You'll see that this has added the total of the salaries, and it is currently automatically calculating a fringe rate for you that is equal to your organization's portion of FICA for that employee. So I would expect when I see a budget that you're not going to have anything less than 7.65% in here. If you actually provide benefits for your employees, and the employees that are working on this project would be benefit eligible, you can change this to any percentage that's consistent with your fringe benefit rate, and you'll see that it makes that calculation over here for you. I'm going to leave this at 7.65% because in my example, John is not benefit eligible. So the only thing that we're paying for is for his taxes. If you're going to be buying office supplies related to this project, you'll put that dollar amount in here. If you, I think Stan talked about the fact that we are going to be providing materials for you, but you may be working with a population that we haven't translated those materials into the language that you need. So you may need to hire a translator to provide external translating services. So I'm just going to estimate what I think that's going to be. I'm going to print those translated materials. And I think the cost is, I'm going to print 500 copies, and it's going to cost me $100 per page to print that. So I'm going to estimate $500 in here for my printing. I'm not going to ship anything anywhere. I'm going to actually have workshops in person. And so I'm not going to put postage into this budget, but you may find that your organization needs postage. And so you can put that in. And then any other expenses that you think that your organization is going to incur related to this project. I will tell you that if you are hiring a new employee to do this work, adding a computer for that employee or a laptop or a tablet might be an acceptable expense. If you're going to be going out and doing workshop related things, you might need to purchase, 3 or 4 Chromebooks in order to execute the project that you have in mind. So I'm going to put $3,000 in here because I'm going to buy Chromebooks to take out and do some digital literacy work. Anything that goes into this other category is going to need to be approved specifically. And I would suggest, I know that as a part of the application process, we're asking for a budget narrative. I would make sure that your budget narrative specifically covers what's in this other category and how you've come up with that calculation. We are going to need to know exactly what it is that you're planning with that amount that's in other, especially because it could be really anything. I think that Stan and Margaret both alluded to the fact that we cannot provide incentives, but we can pay for mileage for a staff person if they're going to be traveling to workshops or whatever. So I'm going to estimate that John and Maria are going to drive 750 miles over the 14-month period. You'll see that the mileage rate is 51 cents per mile. That is the state authorized rate. I know that that is not the federal rate that people are used to seeing, but this is the rate that we are contractually obligated to reimburse, and that DHS will reimburse us. So we can only use this 51 cents per mile rate. You'll see that this comes to a subtotal. And then we are allowing for 10% indirect cost as a part of this project. This indirect cost really is to help you pay for the overhead that is associated with this project. If you have a federally negotiated indirect rate, please let me know and I'll help you with your application, because your application is going to look a little bit different than the bulk of the people on this call. Then this comes to a grand total, and this would be the amount that you would be requesting in your grant application. And again, there is a question in the budget narrative or in the grant application that asks for a budget narrative. So you would be talking about, how many staff, how many hours you think that they're going to be working, potentially some specifics about the things that you expect they're going to be doing. If your fringe rate is different than the 7.65, you would explain why your fringe rate is different. You would explain a little bit about how you came up with the dollar amounts for these other categories, the mileage, and that would be it. We're not asking for a lot of information, but we do need some explanation of what's in your budget. Now I see that there are some questions that have popped up in the chat, and I think that I don't know if any of them are for me.
I have one for you, Debbie.
Okay.
Someone asked, what if the person assigned to this project is a 1099 employee?
So if they're a 1099 employee, we would put them down in other, and we would consider them contracted services, and you would want to explain that in your budget narrative, but that certainly is acceptable through this grant. I don't know if there are any other questions specifically related to the budget. I know that Margaret will take questions related to the application, and any budget questions can go to Margaret first, and then she can reach out to me if I need to get involved. People also can feel free to reach out to me if they need help preparing their budget. My email, I don't know if it's in any of the slides, but my name is Debbie, and my email is just debbie@wisconsinliteracy.org. And I think maybe Margaret or someone, I can put it in the chat when we're finished as well. And that's really all I have with respect to the budget process itself.
Okay, thank you, Debbie. What other questions do you all have?
Can you hear me? I want to ask a quick question,
Yes.
and I'll go back on mute.
Go ahead,
Okay,
Aaron.
I'm sorry, I'm in Puerto Vallarta, Mexico, vacationing, but real quick, if you received the DHS grant, would you be ineligible?
I think I heard you say, if you received a DHS grant, would you be ineligible for this one? No, you would not, but we would ask in the application that you explain what you're doing as part of that grant and how this subaward would help leverage or supplement that grant, so that we're not, because we can't double dip doing the same activities. I'll defer. Debbie, was that a good answer?
Yeah, I mean, I think I would have to look into it a little bit more just to make sure, but certainly one of the things that we do know, because this is federal funding, is that we can't double dip. And so you'd have to come up with additional activities from your original grant application to DHS.
Got it. Okay. All right. Other questions?
Yes, I just wanted to be a little bit clearer in terms of, okay, what I understand is that you have some materials that have been produced for low literacy populations that we could use, and you also have trainings that you would do, and that we could also make modifications to those materials so that it reflects the audiences that we're working with. Is that correct?
Yes,
Okay.
we can co-create with you.
Co-create. Okay. So because I have like my own graphics person, and so he would be a subcontractor listed under as a 1099. But I guess my question is, it seems as it makes sense that you're trying to focus on where communities that have low vaccination rates, high vulnerability. And so in the RFA, it gives a few examples. But when we've been drilling down to census tracts, because I mean, if you just look at a zip code, it doesn't tell the whole story. So I'm just hoping that because some people think, oh no, they don't need money in this particular zip code. Well, no, there's a little pocket over here that does. So I'm just hoping that you would be taking that into consideration as you're reviewing the proposals.
Yeah, in your application, you can, say a little bit about the community that you're planning to reach, and then we will consider that.
Okay, thank you.
You're welcome. Did you want to add anything to that, Stan?
No, I think that was, I mean, that's what I was gonna say, you know, just list the census tract and, you know, part of the applications to explaining, you know, what you know about the community and the concerns and those sorts of things.
Okay,
We're not limiting it to any specific geographic level, I should say, like county versus zip versus census tract.
okay, great. Thank you.
So Stan, I'm gonna let you take Stacy's question from the chat.
Yes, it's the best resource, but it's not the easiest to use. I will say DHS has, like, if you Google in Wisconsin DHS COVID vaccination, it'll take you to a lovely, they've got a nice mapping system, and you kind of have to scroll around on the map, but then you can select areas. You can drill down to the county level, the zip code level, even down to the census tract level, although it does take some maneuvering and things like that to get the information you need. So if you're just looking at like a couple census tracts, you can click on that census tract and it gives you all the data of the number who have at least one vaccination, and then the number who are fully vaccinated. And then you can also do that at the zip code level or the county level too, if you're looking at larger regions. And we can, let's see, we're trying to capture these questions in the recording. So we'll also have some of these resources as we update. We're going to update, put these slides on our website that has the RFA on it, as well as we'll have a recording for this session on there. And we can put a link to that data for the COVID-19. So you can just click it there and it'll take you right to that mapping and data system. What other questions do you have? And if you're like me, you probably won't have questions now, but as you start to fill out the application, several will come up. So please do feel free to reach out to Margaret, and if she cannot answer it, she will field it to any of us. What are the reporting requirements during and after the project? Margaret, do you want to take that?
Yes, so basically for reporting, there is, the financial part that Debbie talked about, but also outcomes reporting. So we'll want to know, how many events you did, briefly a description of what you addressed during that event, whether you were helping people make appointments or if you were discussing the safety of vaccines. And then how many people attended those events and demographic information if you can get it. Debbie, did you want to add something?
Yes, so what we'll be doing, this is considered a reimbursement grant. And so we're going to be asking you to submit for reimbursement every month so that you can get paid as quickly as possible. And that budget template actually rolls forward into monthly reimbursement requests. And so you'll just fill out something that looks very much like what that budget template looks like. And you'll submit that for reimbursement. In terms of supporting documentation, we will ask that you have some form of time reporting for us. If you have your own system, that's fine. If you don't, we have a very simple timesheet that employees can fill out to support the number of hours that they're working on the project. And then to the extent that you have other expenses, receipts, you'll need to submit receipts with that. So we're trying to streamline it. We're trying to make it as easy as possible, but you will need to report monthly in order to get that reimbursement.
Yeah, and I want to add to what Margaret was saying. And two, don't think of events as formal events. An event could be going out and just canvassing a neighborhood and talking to folks, but we'd like to get, the number of contacts. And then we will have like a short, last time we used a short survey. We're still trying to figure out what's the best way, just asking people, some quick questions about their demographics, because we are trying to see who we're reaching by race, ethnicity, geography, and those sorts of things. And then two, if they plan to get the vaccine or if they plan to talk to others, just to see if there's any intent around that. And that we understand that's something that a lot of people may not fill out, so we don't require that. But whenever we can, we really want folks to do that. We'll provide those surveys, and you'll just have to turn them in. We can do all the data entry and everything like that.
And I do kind of, I hope that you will explain to people who might be a little bit apprehensive about giving out their demographic information that this whole grant is based on equity. And the only way that we can make sure that we can demonstrate that those communities are getting served is if, we have that information to show who we're reaching. So hopefully we'll be able to get that demographic information. Debbie, can you answer in other grants via wisconsin.gov, there has been some possibility for a portion as an advance to get started. Is that the case with this one?
Yes, it's a possibility. I guess I would like to have people reach out to us individually to talk about what that would look like and what the needs are, but it certainly is a possibility under this grant.
Thank you. There was something else I wanted to say about the last. Yeah, so just as far, oh, sorry, go ahead.
No, well, I was just going to say while you were thinking of that, but you figured it. Go ahead, Margaret, and then I'll go after you.
I was just going to, sort of like reiterate that, the outreach can even be one-on-one. If you're, when your literacy students is there and you help them, sign up for appointment or show them a website or anything like that, it's still a part of your outreach, and you just record that down and then turn that in as part of your outcomes. Go ahead, Michelle.
I just wanted to say that Wisconsin Health Literacy really wants to approach this initiative and this funding of subawards in partnership with you all. So, traditional kind of fundee relationships aren't always that way, but I want to assure you that reaching out to us with questions, asking for help on financial matters, those kinds of things, even your application is totally what we are expecting and what we have built our support staff to do this. As Stan mentioned and Margaret mentioned, we have regional staff people that they're not all on board yet, but they will be able to help you with this. So please don't be shy about approaching this opportunity in partnership with Wisconsin Health Literacy. I think that outcomes for everybody will be better that way.
And I want to add that part of the role of these regional specialists is to help you on the financial side. We know that sometimes can feel like a barrier to applying for these things. And so the regional specialists are going to be trained on everything related to how to complete those reimbursement applications. They can help you with your budget application. So, take advantage of that resource. We just want to make sure that it doesn't feel like there's any financial side barriers to this project for you.
Right, so they will be able to send you, reminders, to let you to turn in your sheet every month. And then if you have questions or need help filling it out, they can help you and I can help you. So like Debbie said, don't let the barrier of having to fill those budgets or reimbursements out. Just, contact us again if you need any help. Any other questions?
I just placed the link in the chat, and that's where we'll post the slides, the recording, and those other resources that we mentioned today.
And as we see common questions, or themes come through, we'll be posting frequently asked questions as well.
And if there are other community partners who you think this grant would be a good fit for, please do share this information with them. So we would like to make sure that we can reach as many potential subawardees as the need requires.
Yes, Fana, it's open to apply. you could start to apply now with those links that we posted.
Oh, and one last thing, it's more of an old school application. We decided not to go with the form because at times in the past, we've had agencies have trouble filling out forms, and two, it's nicer to have a document that you can continually work on. And so once you complete the application in the RFA, there's an email address for you to submit that. And so that's how you would submit it. So opening the application doesn't, you don't have to complete the form at that time and get it all completed. You can do it as you need to.
Yes, it's a Microsoft Word document, so you'll have to save it and send it in.
Not seeing any more questions. I want to be respectful of your time. Thank you, everyone, for coming today. We look forward to your applications and working with you in the future.
Thank you.
Thank you, everyone.
Bye. Thank you.
Thank you, everyone, for coming.
Thank you.